It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question in this series of questions from my client Melissa. And the question last week was part 3 of my 78-year-old mother has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it, or will she need a tracheostomy? And again, that was part 3 of this series of questions. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question in this series of questions from my client Melissa, which are excerpts from phone and email counseling and consulting sessions with me. And the question this week is part 4 of my 78-year-old mom has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it, or will she need a tracheostomy? You can also check out previous questions answered in this series of questions from Melissa, part 1, part 2 and part 3 again by clicking on the links below this video in the written version of this blog. And if you're watching this on YouTube, just click on the link below this video. That'll get you to the website to all the other episodes. So Melissa writes, "Hi Patrick, quick update. My mum breathed with less support from 10:30 a.m. until 2:30 p.m. The staff are more optimistic now that she will get into long-term rehabilitation soon. They're still doing the tracheostomy on Monday. She really wants it as she's getting desperate to get her mouth free from the tube. Also, I have great news. The doctor I emailed you about, he's gone. Today was his last day of rotation, the staff have told me. I had no clue, but apparently he is, to put it delicately, not the most popular. Gee, I wonder why. Thank you for all your help. My dad told me your talk with him went well. We'll keep you updated, from Melissa." So here is my response. Hi Melissa. It's good to hear that your mother needs less support for now. I'm still not convinced that they have maximized her chances to get her coming off the ventilator without needing a tracheostomy in the first place. I understand why your mother wants a tracheostomy with being in such a desperate situation. Your dad mentioned the long-term rehab facility having a good reputation. No amount of skill and reputation of the rehabilitation facility can replace getting off the ventilator and the breathing tube in the first place without needing a tracheostomy. I have seen those situations over and over again. I know I must sound like a broken record when I say that I believe your mother could have and might still be able to come off the ventilator and the breathing tube when asking the right questions and when following best practice as described in the article and video, How to Wean a Critically Ill Patient in Intensive Care off the ventilator and the breathing tube. Again, Melissa, you simply don't know what you don't know. Because the ICU is most likely pushed for beds and they want to send your mother out to free up their beds. May just be one of the reasons they want to do a tracheostomy rather than trying to wean her off the ventilator and the breathing tube, whilst continuing to answer all your questions. Besides, any ICU should be able to wean somebody off the ventilator on a tracheostomy as well. Again, in order to get the outcomes you want, you need to continuously ask the right questions. They also know that you don't know what questions you need to ask. I'm here to help, even if your mother is in a rehabilitation facility. Being on a ventilator is high risk, and weaning somebody off the ventilator can be a big challenge. Every day can count. You may also want to look at an article and a video with the title Tracheostomy and Weaning off the Ventilator in Intensive Care. How long can it take? You may want to check out this article and video because it will be quite important for you going forward. Now, also letting you know that we are currently working with another client in California who has their mother in a rehabilitation facility that we help to get their mother off the ventilator because it's been months now. So the question really is, why would you send your mother to a rehabilitation on a ventilator with tracheostomy if she might be able to have the breathing tube out in the first place? Your mother might need rehab in the future, but imagine how much more effective rehabilitation would be without a ventilator and the tracheostomy. Also, any intensive care unit should be in a position to wean a patient off a ventilator and a tracheostomy. No need for lengthy rehabilitation on a ventilator. An optimum rehabilitation is one where the focus is on physical rehabilitation and not on ventilator weaning. That's why I'm so adamant that ventilator weaning needs to be done in intensive care, and then they can shift the focus on physical rehabilitation rather than ventilator weaning. Looking after somebody on a ventilator is a highly specialized skill, and rehab facilities often work with non-ICU trained registered nurses that are not ventilator competent. Again, I know you don't know what you don't know, and that's fine. That's why I'm here to help. And you can trust me. After nearly 20 years working in intensive care, I think I have a very good understanding what's possible, what's not possible, and I also have a good understanding where ICUs compromise patient care for the sake of the dollar or for the sake of their bed management goals. Generally speaking, rehabilitation facilities like long-term acute care, remember, is implying long-term and not short-term. They are not known for weaning somebody off the ventilator quickly. Imagine how much easier physical rehabilitation would be if your mother was off the ventilator in the first place. I'll leave this to you and your dad for now. You know where I am if you want to take this further. Now, given that you're watching this, if you want to get one-on-one email or phone counseling and consulting with me, just have a look at the top of the website and seek out one of the options that works best for you. So, here is Melissa's response. Melissa writes, "Hi Patrick, thank you for your thoughts. No tracheostomy today, maybe Wednesday now. A lot depends on the weather because of the snowstorm coming, because we want to be there when it happens. I get what you mean, but it's going on for 3 weeks now. We have the answers to all the questions you told us to ask, and now they're moving her, giving her breathing tests, etc. I was there today when they tried. For some reason or another, she cannot breathe on her own. You told me if we asked all the questions and they were doing everything, then a tracheostomy would seem an option. We also got a second opinion from another doctor, and my dad has a respiratory doctor he knows who also gave him the opinion that a tracheostomy is needed. I would really love if she could be off the breathing tube. I do know that some places may not be well equipped, which is why we are doing so much research. But the bottom line is she wants it, the hospital wants to do it, 3 doctors have told us she needs it, and we have also been told it is or could be reversible and that it may be easier for her to breathe on her own eventually with a tracheostomy and then without it. That about covers it. We are doing all we can and everybody has been great, including yourself. We will continue to do whatever we can to get her better. From Melissa. So here's my response. Hi Melissa, thanks for the update. I appreciate that they have tried and that she simply can't breathe by herself yet. It's been 3 weeks now, and as I explained before in some articles and other videos, 3 weeks is about as long as someone can tolerate a breathing tube. I generally speaking agree that it's too long now and they will need to proceed with a tracheostomy. And if you are watching this and you are uncertain if your loved one needs a tracheostomy or not, just a quick reminder, we have heaps of articles and videos for when to do a tracheostomy, and I just named some of them. You may want to look at how long should a patient be on a ventilator before having a tracheostomy. You may want to look at how long can a breathing tube or an endotracheal tube stay in. You may also want to look at why would a critically ill patient in an induced coma need a tracheostomy in intensive care. And you may want to look at what are the risks and benefits of a tracheostomy. Again, all these articles and videos are linked to below this video in the written version of this blog. Moving forward, once your mum has the tracheostomy and she's medically stable, they will probably proceed moving her to long-term acute care rather sooner than later. For intensive care units, long-term acute care is often one avenue to empty their precious, expensive and in-demand ICU beds. You'll probably be surprised in the difference you will notice going from ICU to long-term acute care. Your mother will be leaving an environment of highly skilled staff, and she'll be going to an environment with far less skilled staff, even though she will require highly specialized skills because she's ventilated with a tracheostomy. You also have to keep in mind that if there are complications like an infection, a change in hemodynamic status such as a low blood pressure and the requirement for inotropes and vasopressors, she will need to come back to intensive care. You can probably hear that I'm not advocating for long-term acute care facilities at all, and I have many reasons why not, because we're dealing with far too many inquiries from long-term acute care facilities where families are telling us that if they had known how poorly LTACs are run, they would have kept their loved ones in intensive care. Again, you don't know what you don't know. I really hope your mother will go into a good LTAC, but I don't think there are many good ones out there. Once she is in long-term acute care, make sure she'll get physical therapy, gets out of bed regularly, has time off the ventilator regularly, gets good nursing care including regular showers, and yes, she can have a shower even while she's ventilated. Don't let them tell you anything else, and hopefully they can wean her off the ventilator. You see, long-term acute cares are meant to be an extension of intensive care, but they're not. They don't work with ICU nursing staff, and they often only have one doctor on site for dozens of patients. It's certainly not the kind of care I would want for myself or for my loved ones. I really hope that things are going well going forward from here, and hopefully your mother can be weaned off the ventilator and then the tracheostomy as a next step. I'm looking forward to talk to you again tomorrow. Take care. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, getting peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivcarehotline.com, and I'll see you again next week in another update.